Which bone is known to contain the largest amount of red bone marrow in an adult? A. Femur. B. Sternum. C. Tibia. D. Humerus. The correct answer is B. The sternum, part of the axial skeleton, contains a significant amount of red bone marrow in adults, making it a key site for hematopoiesis, blood cell production. While long bones like the femur and tibia contain marrow, in adults, it is mostly yellow, fatty marrow. Which part of the skeletal system contains the dens, a structure critical for neck rotation? A. Atlas. B. Axis. C. Occipital bone. D. Mandible. The correct answer is B. The dens is a bony projection found on the axis, vertebra, that enables the atlas, vertebra, to rotate around it, facilitating head movement. Which of the following bones undergoes endochondral ossification? A. Clavicle. B. Scapula. C. Femur. D. Cranium. The correct answer is C. Endochondral ossification is the process by which long bones like the femur form from cartilage models. The clavicle undergoes intramembranous ossification, while the scapula and cranium are primarily formed through different ossification processes. Which bone is classified as a sesamoid bone and is embedded in a tendon? A. Patella. B. Fibula. C. Tarsal. D. Pelvis. The correct answer is A. The patella is the largest sesamoid bone, embedded within the quadriceps tendon, and serves to protect the knee joint and improve leverage during leg extension. Which type of bone cell is responsible for bone resorption? A. Osteoblast. B. Osteoclast. C. Osteocyte. D. Chondrocyte. The correct answer is B. Osteoclasts are large, multinucleated cells responsible for bone resorption, a process critical for bone remodeling and calcium homeostasis. Osteoblasts, on the other hand, form new bone tissue. The acetabulum is a part of which bone in the skeletal system? A. Femur. B. Pelvis. C. Tibia. D. Scapula. The correct answer is B. The acetabulum is a cup-shaped socket in the pelvis that articulates with the head of the femur to form the hip joint. Which bones form the pectoral girdle? A. Clavicle and scapula. B. Humerus and radius. C. Femur and pelvis. D. Sternum and ribs. The correct answer is A. The pectoral girdle is made up of the clavicle and scapula, which attach the upper limbs to the trunk of the body. Which part of the skull does the occipital bone articulate with to allow nodding of the head? A. Sphenoid bone. B. Parietal bone. C. Atlas. D. Temporal bone. The correct answer is C. The occipital bone articulates with the atlas, vertebra, at the atlant-occipital joint, allowing the head to nod up and down. Which bone forms the anterior portion of the hard palate? A. Palatine bone. B. Maxilla. C. Mandible. D. Zygomatic bone. The correct answer is B. The maxilla forms the anterior portion of the hard palate, while the palatine bone forms the posterior portion. Which of the following bones is unpaired in the adult human skull? A. Parietal. B. Temporal. C. Vomer. D. Zygomatic. The correct answer is C. The vomer is an unpaired bone that forms the inferior part of the nasal septum. The parietal, temporal, and zygomatic bones are paired. Which of the following bones is part of the axial skeleton? A. Femur. B. Humerus. C. Vertebrae. D. Scapula. The correct answer is C. The vertebrae are part of the axial skeleton, which includes the skull, vertebral column, and rib cage. The femur, humerus, and scapula are part of the appendicular skeleton. Which hormone is directly responsible for increasing calcium reabsorption from bone? A. Calcitonin. B. Parathyroid hormone. C. Vitamin D. D. Insulin. The correct answer is B. Parathyroid hormone, PTH, stimulates osteoclast activity, increasing calcium release from bones into the bloodstream. Calcitonin, on the other hand, reduces blood calcium levels. The zygomatic arch is formed by the zygomatic bone and which other bone? A. Temporal bone. B. Maxilla. C. Frontal bone. D. Parietal bone. The correct answer is A. The zygomatic arch is formed by the zygomatic bone and the temporal bone, contributing to the cheek structure. Which bone forms the posterior boundary of the pelvic inlet? A. Sacrum. B. Coccyx. C. Ilium. D. Ischium. The correct answer is A. The sacrum forms the posterior boundary of the pelvic inlet, playing a crucial role in connecting the spine to the pelvis. What is the primary function of trabecular, spongy, bone in the skeleton? A. Support weight. B. Produce red blood cells. C. Store calcium. D. Protect organs. The correct answer is B. Trabecular bone, also known as spongy bone, is highly vascularized and houses red bone marrow, where hematopoiesis, blood cell production, occurs. Which bone in the lower limb does not articulate directly with the femur? A. Tibia. B. Fibula. C. Patella. D. Pelvis. The correct answer is B. The fibula does not directly articulate with the femur. It is the tibia that forms the primary articulation with the femur at the knee joint. Which of the following bones contributes to the formation of the nasal septum? A. Sphenoid bone. B. Lacrimal bone. C. Vomer. D. Zygomatic bone. The correct answer is C. The vomer forms part of the nasal septum, along with the perpendicular plate of the ethmoid bone.